Welcome to The Right Chamber, the podcast that takes you inside the NHS to explore what really makes a hospital a hospital.
Each episode, we sit down with the people who keep healthcare moving, from doctors, nurses on the front line, to students, the support teams, administrators, corporate staff, and everyone in between. These are the voices that often go unheard, but together they form the heartbeat of our hospitals.
Our aim is simple: to share authentic stories that are accessible to the public, meaningful to NHS staff, and a reminder that healthcare is more than treatments and wards. It's a whole community working together.
So whether you're part of the NHS family or simply curious about the people behind the service, join us as we open the doors to the conversations that matter here in the Right Chamber.
Ravinder Sota is a multi-award-winning Chief Information Officer for Dudley Group NHS Foundation Trust and Sandwell and West Birmingham NHS Trust. She leads national and local digital transformation, including electronic patient records, paper-free working, and service redesign. With expertise in digital change, legal, and finance, she works closely with clinicians and boards across acute, community, and primary care settings. Welcome to the Right Chamber podcast. My name is Victor.
And my name is Jaspreet. Victor, if I asked you what the IT department does in a big hospital like this, what goes through your head first?
Honestly, I just picture someone picking up and saying, "Have you tried turning it off and on again?" But there's so much more going on behind the scenes. The tech that keeps a hospital running is way deeper than most people realize.
Exactly. From the systems that monitor patient flow to the infrastructure keeping vital equipment online, hospital IT is a whole ecosystem of its own.
And that's why today's episode of The Right Chamber is going to be a good one. We're diving into the world of digital operations inside the NHS.
We're joined by someone who knows this world better than almost anyone, Ravi Sota. We'll let her do a little bit of an introduction about herself.
Yeah, so my name is Ravinder Sota, but everybody calls me Ravi, and I am the Interim Operational Chief Information Officer for the Dudley Group.
Brilliant. Welcome to the podcast, Ravi. So tell us a little bit about what you do within the trust and a bit about your role.
Yep, so being Chief Information Officer for Dudley Group means that I manage the digital data and tech teams at Dudley Group. So that's everything from what you might consider kind of traditional IT, like your network, your Wi-Fi, devices, all the way through into digital transformation initiatives. So that's digitization, improving services through digitization, and moving now into some of the exciting stuff that we're hearing about in terms of AI and ambient voice tech, all the way through into informatics and data, so the application of informatics and data, but also serving kind of statutory returns and requirements for the organisation.
Wow, very, very broad.
So how did you get into this?
So I'm not IT technical by background. I actually have a finance and legal background. So I used to work in financial services, and that's what I did when I graduated, and I worked in the private sector. I moved into the NHS in 2009 because unfortunately my dad became very unwell and I needed to move closer to home. And so I took any job that I could which closer to home, and in my mind it was only going to be temporary. And the first role I took was actually as a band 5 at Coven, Warwickshire, as a implementation manager within the digital data and tech department, rolling out, believe it or not, digital pens to their midwifery and children's service. And then my career just kind of snowballed. So that was a temporary position. And I then moved into service transformation at South West Essex Community Services. Went from an acute trust into community service. And then I've had the privilege of kind of working across several other organisations. So I've worked for Health Education England in my time as head of corporate services. I've worked for NHS England in temporary roles as a consultant, looking at regional roles and national roles, and I've managed whole regions on behalf of them. And again, I've had the privilege of kind of working across community primary care as well as national regional roles. And then I joined Dudley in November 21. Having come from the London regional team at that point. And I joined Dudley as Director of Digital Portfolio. And then last June, I moved into the interim operational CIO role. So it's been quite a journey, really.
Yeah.
Because usually it's the other way around where like people go from NHS to being finance bros and girls, but you went from finance
Yes.
to the NHS.
To the NHS, yeah. And it's very timely because, it was around 2009 and actually there were a lot of constraints on the NHS at that point and financially globally as well in terms of the crash. And so when a lot of my work prior to that had been looking at things like mergers and acquisitions. So, building organisations up or, taking them apart and building them back together. It feels like Lego building, doesn't it? But looking at that and doing kind of large data analysis to understand what population trends were in terms of, would a business be successful in a particular marketplace? Or would it be successful in a different marketplace with a different customer base, would it need to diversify? And those skills were very transferable when you were working in service transformation at that time, because it was largely moving into that space where it was becoming much more data orientated and evidence based.
Yeah. And everything, even as we see them now, it's all kind of data based, isn't it? Pretty much almost every decision. I mean, and it makes sense because lots of things will cost the trust so much, money, and so every decision needs to be backed up with data. And if changes that we're making are actually having the desired impacts that we want them to have. I think you also mentioned at the moment you'll as well as in kind of the Wi-Fi, maybe the electronic prescribing. Where are there any projects you're working on at the moment within the trust?
Yeah, so we've got some really exciting projects. I talked about ambient voice tech before, and we've got a few pilots running around that, but we're also leading on a much wider procurement of ambient voice across the Midlands, with the Midlands NHS England regional team. So that's quite exciting for us. We've got community portal, so we've built our own in-house community portal for our community team. So we're kind of rolling that out at the moment. We've got large pieces of work around our data warehousing and our infrastructure at the moment in terms of our move to the cloud. So we cover a range of projects, from things that you might consider just kind of keeping the lights on and making sure that actually everything's secure from an infrastructure perspective and ensuring that we've got flow of data, all the way right through to kind of service transformation, I guess, for digital, when you look at the use of something like Ambient or AI.
What's the ambient voice tech? Tell us a little bit about it.
Yeah, so the way that ambient voice tech works is essentially just tech that sits in the background. So you imagine that actually right now you're doing a consultation with the patient, and what you might be doing is pulling up like our electronic patient record, and the patient's there and you're typing away into it and you're capturing the consultation as you're going along, or you might be doing it after you've had the consultation from the notes that you've written. What the software does is you essentially launch the software and it's listening into the conversation. So it just allows you to have a conversation in the same way that we are having now. But what you would get at the end of that is a structured output.
Okay.
Which would then allow you to do several things. So you could convert several documents from that one output. So you could ask the Ambient to create you a letter that you might want to send to the GP or to the patient. It can also save a less formal version of the consultation within the electronic patient record if you so choose to do that as well, in terms of the output. Or you can ask it to create a structured output in in a contemplated form for your other, for saving in the electronic patient record. So what it's really doing is just cutting out that kind of administrative.
Yeah.
So it takes your conversation with the patient and turns it into a document that we normally would just type. So time saving.
Yeah, it's time saving. And I guess what it's giving you back is that relationship with the patient.
You pay more attention to them.
Yeah. And it's about that better patient experience for the patient as well, isn't it? And when they're coming in, they don't necessarily want to see like half your face because you're faced towards a computer.
Yeah. That's some of the struggles I've faced in GP.
So they try to listen to them, but you're like,
yeah. Oh wow. So that would really make kind of clinics so much more efficient. As this, and I guess this is something that will continuously be refined as well as it gets better at listening to you and knowing, how to structure your letter or kind of summarize the consultation and things like that. Wow. Okay.
Not even just clinics, I suppose. Even when we have patient interaction in the A&E department, you could use that.
You can use it pretty much anywhere. So the way that it's working now is that the clinicians who are using it in the pilots are having to kind of copy and paste. So it generates the output and they're copying and pasting that into the template that they want in the electronic patient record. But the piece of work that we've been working on in the background is integrating that into our electronic patient record. So you essentially just open up the electronic patient record. The ambient voice sits in the background. So you don't need to open that. You would go to the document you want in the electronic patient record. There's this little button. It asks whether you want to start the ambient. You'd say yes. And then it just automatic that you continue and it automatically like picks it up and puts it into the template that you've selected, and then at that point once it's completed or you've completed your consultation, you review that, and then obviously once you click save, that's when it does all the bits that it needs to do. So really the possibilities are that you could use it on any document that you have within the EPR. You could even do ward rounds with it, really.
Wow. Those fast-paced surgical ward rounds would be so much more manageable.
Much easier.
It'd be so much more manageable. Wow.
I'm assuming this is going to be on an NHS device.
Yes, yeah. So you have to use it on a trusted device, like you absolutely must. And it's one of the reasons why we're carrying out the pilots is to make sure that actually when we're implementing this, we're implementing it safely. It's not ready to use out of the box. I think people make that misconception that you get it and it's just ready to use. You have to be able to tailor it. It needs to get used to your voice, your cadence, your accent, your dialect. You can get it to learn over time the way that you like to talk about something. So if you like to abbreviate something, or if you have you're using like a shortened word form for something, it can also pick that up over time, so you can train it. And you have to be really clear about the prompting as well, so it will generate something, and actually you might look at that and go, that's not detailed enough. So what you might want to do is obviously add a prompt into it to say, well, actually I want you to generate more information on the background, or I want it to have much more detail around the plan that I'm submitting around this patient. So you do have to optimize it for use for you as an individual. But once you've gotten it to that point, it's fairly easy to use. You almost don't really need to think about it because it's sitting there in the background and it's doing what you want to do. The important thing is to remember that you still got to check it. Like, as a clinician, you're still responsible for the output, so you still need to check it to make sure it's accurate.
Wow.
Oh, it's like, when they dictate.
Yes.
And then they still need to check it when like their secretaries has
Exactly.
typed it out.
Make sure it's
Yeah.
That would cut out this hectic job for the secretaries to like quickly type it out as well.
And I think that's the intention, is that what you're stopping is that downstream flow of administrative work, like hitting like those staff, and you're getting it done there and then. I think some of the early feedback that we've had has been really positive around the fact that actually it is helping form better connection between the clinician and the patient. Like from a patient experience point of view, it's just so much better.
And all these will have downstream effects as well on like costs for cost saving for the NHS. It should just allow people to focus more on those kind of important jobs, as you've said.
I think the important thing to remember though as well is that actually there's a real human side to this around retention, reduced staff burnout, making life easier. I think what we don't sometimes recognise is that actually implementing tech can be really difficult sometimes for clinicians because it's actually adding a step. Like there's no way that typing into an EPR is faster than typing on a piece of paper. Like there's just no way. The difficulty you have is that you might not be able to read what's been written on the piece of paper, especially if you're not the one who wrote it and you're looking at those notes, or that piece of paper can get lost. And so therefore, the electronic patient record has advantages in that way, especially in terms of continuity of care for the patient, being able to have the information available, being able to actually read what's in the patient record, it not being lost. But it's certainly not faster than someone being able to scribble on a piece of paper. I think what we're seeing now with some of the advent of the new tech that's coming in is that actually it is. Like it is, because what you're doing is speaking. So what it's doing is it's now no longer adding in an additional step, or what it's actually doing is helping you to be so much more efficient and faster in the way that you deal with that.
That is like with tech, isn't it? When everything goes well, you shouldn't notice it.
No, you shouldn't.
Okay, so it's becoming a big thing now with innovation and technology, and the big buzzword is AI. I guess this might be a demonstration of it, but are there any other overt demonstrations of where we're using or incorporating more AI?
Yeah. I mean, our stroke department use AI, like they've been using it now for a while, and they'll talk to you all day long about the kinds of improvements that they've been able to see as a result of that, and you can see that, and actually is really helpful in being able to kind of triage high risk patients, and understanding. Like I say, you can't get away from that clinical check. You still need to have that clinical check to understand, because what you have to be careful of is realizing that there's still bias in AI. Like, there's bias in medicine anyway. We know that, and we know that most modern medicine is based on the fact that it's typically geared towards kind of males, and assumes that women are just smaller males with slightly different body parts. And actually, you have to be really careful about that. We know that happens, and we know that is what modern medicine is based on. I think what you have to realize is that that's still true even with tech. You're going to have bias, and you have to realize that there is absolutely no way that anybody who's working in the fields of AI could have tested their AI on a large enough patient base to have covered every single possibility of what that patient could present with, or the different circumstances in which they could present with. So the AI is still going to show patients who it thinks is abnormal, who are perfectly normal. When you look at everything else, and it's going to show patients who it thinks or flag patients who it thinks are normal within normal ranges, who are completely abnormal, because when you look at everything else and their underlying health conditions and risk factors and everything else, and you look at that patient holistically, you can tell. So you do still have to have that check. And I think the worry is when people think the AI is so good because it's getting it right so often, you can see that there is a tendency to be complacent about it, and to go, well, we think it's at a point where it's so great that actually we don't really need to properly check it. We can just skim over it and we're pretty assured. And that's a dangerous position to be, because actually you need to treat it as if it were somebody else carrying out that role. Like, you would never do that. You'd still be wanting to check it.
Yeah, it's a tool, isn't it? And it should be used as a tool rather than just complete reliance on it.
It's like an assistant rather than like the main part.
It's not replacing you as a clinician. Like that's fundamentally it. It's not replacing you, and you need to understand that. And actually there needs to be an understanding that it is going to get it wrong sometimes.
We normally think that IT department is when your laptop stops working and you ring them and they're like, have you tried turning it off and turning it on again? And now we know that you do a lot more. Are there any other misconceptions that you have heard about IT from the NHS staff?
I think it's really interesting when you go and you're looking at certainly transformation from a digital lens, because I think there is always a misconception that either that's an IT project and IT are going to deal with it, or that's your responsibility to deal with. And we are moving away from that. You can see that there's certainly a level of maturity that's coming through now in the fact that actually you can't leave your IT department to be implementing this. It needs to be owned by the organisation, because that's where the real impact is going to be. And actually, if we own every single digital initiative, then there's absolutely no ownership from anybody in the organisation. So it never truly gets embedded. And actually, that's a complete waste. And I think we're moving much more into those intelligent conversations around that. It's got to be co-ownership and collaboration and co-production. You have to work together in order to get to that point. I think there's also a real kind of misconception about just the amount of skill it takes to be able to do this successfully. I think there is a real misconception around the fact that if you have people who kind of dabble in IT and like it a little bit, and they've kind of built some databases at home, and they know a little bit, and they've learned how to use like AI apps like Gamma or ChatGPT, then no, it's true that actually that means that they are IT professionals.
Expert.
And I say that loosely. And actually, this is something which is really interesting. So I was on a roundtable a couple of months ago, and this was the argument that one clinician was making, that actually he's an IT expert, because they had also rolled out Ambient. And so I was really interested in this, because obviously, like, we've taken years like to hone our professions. Like, we're professionally accredited, like we're professional bodies just like everybody else. So to hear somebody kind of go, well, actually I do this and I'm a clinician and I understand my operational workflows, and so therefore like I'm just as good as you, it's one of those things where actually you immediately go, oh, prove it,
Yes.
like prove it to me. And actually, it's really interesting to hear them listen about how they had rolled out Ambient, because they actually hadn't done any of the security checking, any of the vetting, any of the compliance. His pilot, and again, I'm using that inverted commas, was to over 300 people. Now, at that point, it's not a pilot, like it's business as usual. Like, you've got 300 staff using it. Like, that's a lot, So it was really interesting to hear about this, and just the kind of lack of assurance. And so when we were having this conversation, I was talking to him around, well, how are you going to do this governance piece? Because quite interestingly, only a few weeks before, there had been a message sent out from the centre. So the central team had sent out a message saying, we know a lot of you are getting involved in this ambient voice tech, or we know a lot of you are using it in private at home, which you shouldn't be doing. And actually, we've got this set of guidelines that we want you to follow, and they set out all this guidance. It was really interesting, some of the conversations that were being had, because it was really clear that people actually hadn't followed any of the guidance, or weren't even aware that there was guidance that they should have been following anyway in the first place around this. And it's all standard guidance. And so actually, you then begin to see like the real big gap between people who do this every day and who are learning, but we're still learning. Tech is moving so fast that we're still learning, but the expectation is that we learn a lot faster than everybody else, so that actually we're there to guide them, and to do it safely, and not introduce a level of risk that would be unacceptable to our organisations. And it was really interesting listening to that conversation. What was even more interesting is that there were operational staff sitting at this round table who also thought that they were digital experts. And yet when the person who was moderating the round table was talking about all of this kind of AI tech and who's used these different AI websites and who knows about these, and all the digital professionals were like, yep, heard of that one. Everyone else was like, no.
You're like, they're like making a little list, like, absolutely not.
Yeah. And you realise that actually that's the difference, I would never walk into pediatrics and be like, I've had 2 children, I'm an expert.
I get it.
You know what I mean? Like, that would never happen. But you do get it all the time. Like, you get people telling you like about tech, and you're sitting there going, I know, like, this is my job.
No, that's very interesting. And the fact that their pilot was like 300 people, how are you like auditing that? How are you making sure that data is not being breached?
Which is the importance of that data collection, isn't it? It allows that safe rollout to know that, and it instills trust in the patients and the public that, we've not just downloaded this thing and popped it on the system, but actually it's gone through phased release where we've also collected feedback and data to know it's doing what we want it to do.
Yeah, and also Tony hasn't just taken your patient details home and isn't doing this like in his garage at home, like writing up all these notes with all your patient data like on his home PC. Like,
I see that's the danger, like when people can be like, well, I can just take it home and finish my work at home instead. But where's the
Yeah, there needs to
privacy
be
there?
guidelines, you know? Yeah, okay. And these guidelines, are there kind of national governing guidelines or stuff we come up with locally, or
There'll be a mandatory training for that. I'm pretty
yeah. No, there are national guidelines. Like you have like compliance guidelines, you have clinical safety guidelines that you must prove that actually what you're implementing is clinically safe, and it must go through a series of tests. So you can't implement anything digital without kind of proving that it's safe, and you must document it in a hazard log. So you must document the risk. So for instance, you could implement something and there might be a risk that in terms of implementing this piece of software, that there might be inherent bias in it. So actually there's a whole lot of work that goes into this in the background that actually nobody really sees. And actually, in all honesty, they probably don't care about, and they shouldn't, because that's our job.
Yeah. Wow. And this is just the tip of the iceberg, and so much things that's happening when it comes to the tech world of how everything is running and stays running, because all these things will require maintenance, and ultimately tech does what tech does, where things breaks and bugs develop, and they'll need maintenance. And so it's so important that we have this corporate services that are here for things to function as they should function. I suppose that's an interesting point to land on, is people, I guess, when you think of the hospital, you think nurse, doctor, the people, you see standing next to the patient. So it can be easy to then kind of overlook everything else that's causing the hospital stand on its legs. I don't know. Do you have any thoughts on the importance of awareness of this, the corporate services and what they do?
Yeah, and I think even more so now with political climate around, like we're seeing lots of news stories around reduction, and it is typically corporate services staff that are being asked to reduce. And I think it's a really trying time, if I'm being honest. And I think there needs to be a recognition that actually those corporate services, as you said, do work in the background, that they are there, but they are really fundamental to keeping everything going as well. And we typically kind of think about the stress that there is on frontline staff. And I'm not saying that there isn't stress on frontline staff. We see it. We work in a hospital every day. We know what that looks like. And there is a lot. And those frontline staff do have to deal with a lot as well, especially when they're on the front end. But there is a tendency sometimes, I think, to forget that actually there's this whole army of staff who are working in the background who are just as dedicated to the NHS as your frontline staff, who are also dealing sometimes, with the pressures that actually the rest of the NHS is under. And actually, what they're doing is they're also trying to manage their own teams and then support frontline staff as well, through those services. And I think it's really key to remember that actually they're a really key component of this. Like you need both, you need both to keep things running and running smoothly. And I think what's happening is unfortunate, because I think what people are taking away from that is that, and certainly I've seen it in some of the posts which are being posted on social media, is that people feel as though the general message is that they are expendable, like they are replaceable. But there's also that understanding of actually what some of the staff are going through in the background, and the way that they're trying to support services is really important. It's a relationship, isn't it? It's a reciprocal relationship.
And that's what it boils down to, isn't it? It's how everyone works together as a team, and recognizing that it is a team, more than maybe who you just see standing in front of you, but there is a whole team of, a symbiotic relationship of how we all work together to cause this machine called a hospital to work.
Yeah, and you can see the difference. Like you do see the difference, because what's so happening is that barriers are being broken down. I remember certainly when I first started working in IT, it's very much a them and us. Like you worked in IT and you were over here, and clinical services were and they were over there, and you only kind of got together when like there was a real need for you to have a conversation. But otherwise, you went your separate ways and you just did what you needed to do, and that was it. The emphasis now really is on you need to, it's been proven that what you need to do is you need to work together so much more because you get better outcomes from that.
Yeah.
You need to co-produce, especially in digital data and tech, like you absolutely must, because your end product is not going to be for you as an IT team. It's going to be for the end users, and those end users, there could be a multitude of end users. And so actually it's really important to ensure that actually what you're designing and producing is going to be of use to them. And so you absolutely cannot get away now with not working in tandem with them. If you don't do that, all you're doing is creating something that's not going to be fit for purpose.
It's not always a straightforward journey, clearly, getting into, tech, specifically in the hospital. If there's someone, maybe in college right now thinking about uni or just graduated university, thinking about opportunities in tech and perhaps how they can get into the NHS, I'm sure it comes with its own challenges, maybe even on the awareness side of things and not even knowing what's available. Are there any tips or advice that you might have for someone in that position who's looking to build themselves into a career?
Or do you have like shadowing programs like we have for doctors, like work experiences?
Yeah. So we do take on work experience students, we do, and we've been approached, and we work with a lot of our local colleges as well. So that we've had T-level students, for instance, and so it's really interesting looking at the kind of variation that you get and being able to support them. I think the biggest thing is that you need the experience, they need the exposure, and they need the experience because you don't know the things that you don't know. And it's really easy for us because we've worked for years now in professional environments, and actually going through different professional environments I think is really important. It's important not to think that working in one organisation is the way that happens across all organisations, because it isn't. And what you need is adaptability. And I think you only really get that with exposure. You do find people who have that natural skill, like they're just naturally adaptable. They can tailor themselves to their audience. You see that they pick up on cues very quickly in terms of body language and voice cues very quickly, and you see that coming through. But I would say that that's very rare, and we don't see a lot of that. And actually, what we see are students who need exposure to a wide range of areas in order to become really well-rounded. And I think it's that understanding of actually working in a workplace is so nuanced. It is. It's not just about building the relationships, it's about trying to find the balance between building relationships but realising that actually what you can't do is sacrifice your integrity or your moral values to
Absolutely.
keep people happy.
Yeah.
You've got to ask the questions, you've got to challenge.
So it's important to, say, well, or keep open to opportunities, even from your experience working in so many different sectors, and you don't lose all those skills, even if it's a specific thing, but you pick up something from all the different areas. If you think back, would you say that's accurate that, the different sectors you've worked in, you have brought some transferable skills from all those places?
Yeah, definitely. And I think you don't realise that at the time, do you? It's almost like osmosis, isn't it? Like you're not realising what you're picking up until you land in a completely new environment, and you're like, but I've seen something better like 5 years ago. Like, so we could move to that. And what you need to be open to is understanding that actually you need to be flexible in your approach. So you can't just lift and shift, because like that's very rarely appropriate. What you need to do is be flexible. And I think it's really important that you're not coming in with an answer. Like, the most important thing is just to listen and understand what's the issue, and then go away and think about, well, how do you resolve it in the best way? I think the other thing is the NHS has always been very hierarchical, and I think sometimes it's really easy to confuse years of experience as experience. And I think that's something that you do have to battle against something that I certainly had to battle against, is that you don't necessarily need to have years and years and years of experience. It's about understanding what do you actually have, what have you had exposure to, what have you actually done. That means that you're bringing that skill set in.
Adaptable.
It's not just that they've been in that one and
they just repeated
it and they got it lucky and all the circumstances worked for them, because that's happened to me as well. Like, I'll be honest, like, I've done things and I thought it's never going to work, but we're just going to go with it, and the stars have aligned and it's like gone off like a bomb, and I thought I'll never be able to replicate that anywhere else because that was a one-off,
And repetition makes perfect, right? So they're probably just good at that because they continue doing that.
Because they continue doing that, and actually maybe in the role that they're in, that's been fine. I think when you're looking at the roles that we're in, certainly transformational roles, you've got to evolve and adapt.
Yeah,
like,
innovation is so big.
You've got to innovate, you've got to have new ways of thinking. And I think the biggest thing is not to assume that you know everything. Don't go into somewhere with a preconceived idea of what the outcome should be or what the solution should be. Really listen to what the problem is, and then go away and go, I've got this solution. Then go away and think, well, how can I make it better?
That's what technology's done in the NHS. Like, it's becoming better and better.
Yeah, I'm figuring out how we can apply it, or even thinking outside the box as well. If we bring 4, 5, 6 heads together, all from different experiences, then we can, potentially create something really beautiful and innovative that would just send us into the future.
And I think don't be scared of doing something new. And I think that's always a blocker. And I always feel like it's because we default back to this is the way that it's always been done, or this isn't happening anywhere else. And it's like, yeah, but that's why it's innovation, because it's not happening anywhere else. If you do it, it'll be innovative. Like, let's try and think of something new.
It's been such a really good conversation with you, Ravi.
Thank you.
Just learning about all you do and the different innovations that are going on. As usual, for all our listeners, feel free to interact. Send us questions if there's something that we've said today that you haven't quite understood. Let us know and give us your feedback as well. And if you'd like to participate as well in a future episode, feel free to get in touch with the team. Brilliant. Thank you. Thank you for listening. Until next time. Remember to stay connected with us on social media. Follow us on Instagram and TikTok at RGUCMS, and subscribe to our YouTube channel, RGUC Media, for more exclusive content and updates. Thanks for tuning in to the Right Chamber podcast. Until next time.